Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by our senior colleague, Dr. Nath Arua, a clinical pharmacist by training and profession, who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here, we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of Nath Arua and the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 137 of our Pharmacotherapy MCQ series, which majors in infectious diseases. And the first question reads, APL: a middle-aged homeless male presents to your hepatology clinic expressing fears of having been exposed to hepatitis. His serology results for Hep A, B and C are as follows. Anti-HAVIG, M, negative. Anti-HAVIG, G, positive. Anti-HBs, positive. Anti-HBC, negative. HBsAg, negative. HCVAb, negative. Basing on the above serology results, which of the recommendations listed below is the most appropriate for APL's case now? Is it A, no vaccination is needed, or B, hepatitis A and B vaccination is needed, or C, hepatitis B vaccination is needed, or is it D, hepatitis A vaccination is needed? I will give you a few seconds to choose the correct answer to this question from the listed options. And the correct answer is A. No vaccination is needed. Since the patient has the presence of both hepatitis A and B antibodies present, the patient already has immunity to both viruses and does not require vaccination. If the anti-HBC was positive, immunity to hepatitis B would be secondary to exposure instead of previous vaccination. Let's advance to the next question, please. And the next question reads, GBY is a middle-aged male patient who is newly diagnosed with HIV and HBV co-infection. Which of the regimens listed below would be the most appropriate to initiate in GBY's therapy now? Would it be A, rilpivirine and dolutegravir? Or B, abacavir and lamivudine plus bictegravir? Or C, abacavir, lamivudine, and dolutegravir? Or would it be D, tenofovir alafenamide, emtricitabine and bictegravir? I will give you a few seconds to choose the correct answer to this question from the listed options. And the correct answer is D, tenofovir alafenamide, emtricitabine and bictegravir. Tenofovir, emtricitabine, and lamivudine all provide coverage against HIV and HBV co-infection, but lamivudine and emtricitabine should not be used alone for HBV as the development of resistance is relatively high. Therefore, tenofovir alafenamide or tenofovir disoproxil fumarate is the recommended first-line option for the management of HBV. The most appropriate answer is tenofovir alafenamide, emtricitabine and bictegravir. Although lamivudine does provide coverage against HBV, the development of resistance is relatively high. Abacavir, dolutegravir, and bictegravir do not provide any activity against HBV and, therefore, are not appropriate choices. In addition, bictegravir is only available as a combination product. Neither rilpivirine nor dolutegravir provide activity against HBV and is not an appropriate choice. Let's advance to the next question, please. And the next question reads, HPB: a middle-aged patient presents to your gastroenterology clinic and is confirmed to be hepatitis C infected. He is treatment naive, so my question to you is, which of the hepatitis C treatment regimens listed below would be the most appropriate for HPB? Would it be A, sofosbuvir, velpatasvir and voxileprevir for genotype 4, or B, glecaprevir, p-brentasvir for genotype 1, or C, elbasvir and grazoprevir for genotype 3, or would it be D, ladipasvir and sofosbuvir for genotype 2? I will give you a few seconds to choose the correct answer to this question from the listed options. And the correct answer is B. Glecaprevir and pibrentasvir for genotype 1. Glecaprevir and pibrentasvir is a pan-genotypic HCV therapy that treats genotypes 1 to 6. Ladipasvir and sofosbuvir provides coverage against HCV genotypes 1, 4, 5 and 6. Elbasvir and grazoprevir provides coverage against HCV genotypes 1 and 4. While sofosbuvir and velpatasvir and voxileprevir does provide HCV coverage against genotype 4 as well as 1, 3 and 5, and 6. Since it is a pan-genotypic regimen, it is not indicated for treatment-naive patients, but patients previously treated with an HCV regimen containing either an NS5A inhibitor or sofosbuvir without an NS5A inhibitor. Let's advance to the next question, please. And the next question reads, DBV, a middle-aged patient is confirmed to be hepatitis C infected. He is treatment naive with genotype 3 decompensated cirrhosis. So my question to you is, which of the hepatitis C therapies listed below would be the most appropriate to use in DBV's case? Would it be A. sofosbuvir and velpatasvir, or B. Glecaprevir and pibrentasvir, or C. Elbasvir and grazoprevir, or would it be D. Ledipasvir and sofosbuvir? I will give you a few seconds to choose the correct answer to this question from the listed options. And the correct answer is A. Sofosbuvir and velpatasvir. Sofosbuvir and velpatasvir provides pan-genotypic coverage against HCV genotypes 1 to 6. Ledipasvir and sofosbuvir is not indicated in genotype 3. Elbasvir and grazoprevir is not indicated in genotype 3, nor should it be used as patients with decompensated cirrhosis. Although glecaprevir and pibrentasvir can be used for the management of genotype 3 HCV, it should not be used in patients with decompensated cirrhosis. And the next question reads, TTM, a male patient with GERD requires treatment for hepatitis C. He currently takes omeprazole 40 mg orally once daily for GERD. Which of the hepatitis C therapies listed below would be safe to co-administer with omeprazole 40 mg orally daily in TTM's case? Would it be A. sofosbuvir, velpatasvir and voxileprevir, or B. sofosbuvir and velpatasvir, or C. Elbasvir and grazoprevir, or would it be D. ledipasvir and sofosbuvir? I will give you a few seconds to choose the correct answer to this question from the listed options. And the correct answer is C. Elbasvir and grazoprevir. Elbasvir and grazoprevir does not have any dosing restrictions when combined with proton pump inhibitors (PPIs) and may safely be used together. Doses of PPIs comparable to 20 mg or lower can be administered simultaneously with ledipasvir under fasted conditions. Doses greater than the dose equivalent of omeprazole 20 mg may reduce the bioavailability of ledipasvir. The use of PPIs with velpatasvir is not recommended because PPIs can reduce the serum concentration of velpatasvir. If this combination cannot be avoided, sofosbuvir and velpatasvir should be administered with food and 4 hours before omeprazole. Let's advance to the next slide, please. And the next question reads, STP, a 40-year-old male has been recently deployed to go and work for the UN in a refugee camp in a remote part of northeastern Kenya the next 90 days for a period of 2 weeks. His hepatitis serologies are as follows: anti-HAV, IgM, negative. Anti-HAV IgG, negative. Anti-HBs, positive. Anti-HBc, negative. HBs-Ag, negative. HCV-AB, negative. So my question to you is, which of the recommendations listed below would be the most appropriate regarding the immunization requirements for STP prior to assuming commencing new duties? Would it be A. obtain hepatitis A and B viral loads, or B. initiate Havrix, or C. initiate Twinrix, or would it be D. immunization is not required? This patient is not immune to hepatitis A, due to anti-HAV IgM and IgG results being negative. I will give you a few seconds to choose the correct answer to this question from the listed options. And the correct answer is B. Initiate Havrix. Option B is correct since the patient would benefit from vaccination for HAV with the single-agent vaccination based on the lack of antibody to HAV. In addition, vaccination is necessary due to travel to an area that is highly endemic to hepatitis A. Option A is incorrect since the patient is not immune to hepatitis A virus and would benefit from HAV vaccination since they are traveling to a remote area. Option C is incorrect since the patient already has immunity to HBV, the combo product of Twinrix is not needed. Option D is incorrect because obtaining viral loads are not necessary for this patient unless there was concern for active infection. Let's advance to the next slide, please. And the next question reads, ALK. A middle-aged male patient presents to the gastroenterology clinic to make inquiries concerning hepatitis A infection after reading many alarming articles on social media. My question to you is, in which of the following clinical scenarios isn't hepatitis A vaccination recommended? Is it A. Injection drug users, or B. Persons traveling to areas where virus is endemic, or C. Children below the age of 1 year, or is it D. Men who have sex with men? I will give you a few seconds to choose the correct answer to this question from the listed options. And the correct answer is C. Children below the age of 1 year. Option C is correct since children prior to the age of 1 year is not an indication for vaccination since it should be initiated at 12 months. If travel is planned outside of the US, then vaccination should be performed. Options A, B, and D should be vaccinated against hepatitis A. Men who have sex with men is a risk factor for contracting HAV and should receive vaccination. Travel to endemic areas is a risk factor for contracting HAV and should receive vaccination. Injection drug use is a risk factor for contracting HAV and should receive vaccination. Let's advance to the next question, please. And the next question reads, which of the markers listed below would you consider the earliest serologic marker of hepatitis B infection? Would it be A. HBsAg, or B. HBV-DNA, or C. anti-HBC, or would it be D. HBeAg? I will give you a few seconds to choose the correct answer to this question from the listed options. And the correct answer is A. HBsAg. Option A is correct because HBsAg is the first and earliest serologic marker to appear in both acute and chronic HBV, while anti-HBC and HBV-DNA do appear after HBsAg. HBeAg may or may not appear. So there you have it. Our highly esteemed viewers and listeners, that brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom. And if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. On behalf of my senior colleague, Nath Arawa, I would like to thank you very much for viewing this video. I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video.